Did you know that 4 out of 5 patients would choose a ceramic implant over a titanium implant if you would ask them? And did you also know that today's ceramic implants are as stable as their titanium opponents in the same diameter and have similar healing rates above 95 to 98%, but don't suffer from peri-implantitis? Hey, I am Dr. Tobias Steinher, and when I started with ceramic implants more than 5 years ago, many implant companies advertised their ceramic implants as a more aesthetic choice because zirconia implants have a bright tooth-like color compared with titanium being gray. So at that time, I mostly placed bone-level implants, bone-level titanium implants. So this argument was actually complete nonsense to me. And yes, it's true that with thin bone and the thin biotype, even bone-level implants can shine through the tissue, but actually it's the job of a good surgeon to avoid such cases because they would also have a much higher risk of mucositis and peri-implantitis later on if the hard and the soft tissue are so thin. But what reasons are there for zirconia, and why should you, if you're a dentist and always looking for the best treatment options, consider switching from titanium to ceramic? To answer this question, we have to talk about biocompatibility. And in this video, I will talk about the 3 most important reasons why modern zirconia implants are so superior to titanium. Well, you might say, now what's that guy talking about? Titanium is perfectly biocompatible. I've been using it for more than a decade or longer. What are we even talking about? Yeah, and at least that's what we all learn at dental school, right? Titanium is a perfect biomaterial. But if I tell you that today's data shows us that almost 50% of patients with titanium implants suffer from peri-implantitis after 10 years, how can we call it biocompatible then? Yeah, that's because of bacteria and the patient's genetics and immune system. And yep, that's true to a certain degree, but what if titanium as the material itself contributes to this whole process? It might be even the main driver of the peri-implantitis wave that we are facing today. So maybe you remember the time when the one abutment one time concept got big. At that time, BioHorizons came out with their laser lock surface to mimic the effect we already knew from the full zirconia abutments, that connective tissue can mechanically attach to zirconia but not to titanium or metals in general. But zirconia abutments had their problems with a much higher fracture rate, of course, and often the destruction of the titanium interface, because zirconia is much harder than titanium, but this only shows us that we didn't understand zirconia at the time very well. And the same mistakes are unfortunately made even still today when manufacturers try to build bone-level implants completely in zirconia. So little spoiler alert from my side, I think it won't work properly, and in contrary, it will result in more unfavorable outcomes, but that's actually a topic on its own. But with a full zirconia implant that is designed properly, you have not only a high stability in the critical interface between the bone and the gum line, but also a real seal as the fibers and the connective tissue attach to the zirconia surface and close the gap between the oral cavity with its different species of bacteria, good ones and the bad ones, and the bone with its weak immune system. There are even studies which show that the blood flow in the tissue around the zirconia is similar to natural teeth, whereas there is scar-like tissue with a significantly reduced blood flow around titanium. So if you have a similar soft tissue around your implant like around your teeth, that's a valid argument for long-term stability, right? But let's go literally one step deeper, and let's talk about hard facts. We need strong bone around our implants. And titanium does a good job in osseointegrating in all different kind of bone types. But what happens if we take a closer look at the histology of our implant surrounding bone? Someone who did this was a group around Professor Albrechtson in 2013. They performed a study which shines some light on this topic. For all of you who are not familiar with Professor Albrechtson, He was a co-worker from Per-Ingvar Brånemark, and Per-Ingvar Brånemark can be considered as the inventor of the modern titanium implants in the 1960s. And Professor Albrechtson and his team found in the histological studies that, like the soft tissue, also the bone is a more scar-like tissue with a sparse blood circulation. So he and his team concluded that marginal bone loss is not a primarily related to biofilm-mediated infectious processes, but it seems more like a foreign body reaction. But how could that be? I mean, titanium is so biocompatible, right? Well, to understand that, we have to know a bit more about titanium as a material itself. Titanium has a thin oxide layer on its surface, and that's the reason why it is accepted by the human body. Without it, it would be rejected like any other foreign material. This thin oxide layer can be harmed due to the different kinds of corrosion we talked about in a different video, so the most important one here would be the biocorrosion. And like any other metal, the single titanium elements are connected with a so-called metallic bond, and they share moving electrons, and these free moving electrons can be released from the structure due to oxidation, which is one key element of corrosion. And although zirconium is a metal in the periodic table as well, we are talking about zirconium dioxide, also referred to as zirconia. And there is a strong ionic bond between the zirconium atom and the two oxygen atoms, which makes it an oxide ceramic, which can't release free electrons because simply there are none. If you understand this basic difference, it also becomes obvious and logical how a study like the following can come to the finding that there is nothing like peri-implantitis around zirconia implants. So if you have a natural seal around your implant neck, if you have the same blood circulation around zirconia, like around natural teeth, if you have healthy bones with proper blood circulation around your implant body, and if there is nothing like corrosion and therefore no foreign body reaction to your implant material, there is nothing that comes as close to our natural teeth than zirconia implants. And if you've been in the business for some years already, you know that in the end, it's the long-term success we are all looking for. So if your goal as a professional is to always strive for the best and the most successful treatment options, there is no way you can ignore the advance of zirconia implants any longer. There are some major differences to titanium in terms of handling, etc. you need to know, but once you master the switch to zirconia, you will get the more aesthetic results in the short term and the more stable results in the long term. If you want to get more insights and learn more about ceramic implants and biological dentistry, then make sure you subscribe to the channel and check out the links in the description box below, because always remember, if we can do better, we should do better.